Definitely mine. I have been so heartened throughout the horrors of this pandemic to see that there are medical professionals like yourselves who are committed to not just engaging in the research and putting the products out there that can keep us safe, but who are also very much vested in education. And there's a lot of gaps in our education right now, even though we've been living with this pandemic for the past, we're now, what is it? We're entering the third year of living with this pandemic. We have seen a lot of the inequities that we already knew existed in our society, but we've seen them through a magnifying glass. And that magnifying glass has been the pandemic. And one of the ways that those inequities show up to this day, Dr. Hotez, as you well know, is this global inequity for vaccine access. Can you talk with us about how those inequities have traditionally shown up, with whether it's with COVID or other diseases, and what vaccine equity would do if it were a goal that we were actually striving for?
Well, thanks so much. I mean, you're absolutely right. We've had vaccine inequity upon vaccine inequity, right? Because both here in the United States, it was a huge issue with BIPOC communities across the United States, and people like Dr. Hudson worked really hard to try to address that. And I think with some successes also, we could talk about that, but we still have the global vaccine inequity. I mean, the African continent is largely unvaccinated, and Southeast Asia and many parts of the poorer countries of Latin America, not much better. And the reasons we have to care about that, aside from the obvious humanitarian concerns about the inequity, is the fact that our worst variants of concern now have been arising out of the low middle income countries when they're not vaccinated. So the Delta variant came out of an unvaccinated population in India at the beginning of last year around this time. And then later on last year, we got the Omicron variant out of Southern Africa. So, Mother Nature's not being coy with us. She's telling us exactly what she has in mind for us. Yeah. As long as we refuse to vaccinate the world's low and middle income countries, she's going to continue to hurl variants. And I have to, so we've got to stop, this complacency saying now that Omicron is really going down, or it is going down across the US, that we're just in for another wave, and possibly as early as the summer, just like we had in Texas and the southern states in 2020 and again in 2021 with Delta. I think we're in for it again unless we finally have that resolve to vaccinate the southern hemisphere and other low middle income countries.
Dr. Hotez, as I'm hearing you talk, I'm having a little bit of cognitive dissonance, and I'm saying that a bit tongue in cheek, because, I'm in New York and we don't even have a vaccine requirement now to enter restaurants. The masks are off. I'm seeing more of people's faces. I've seen more noses and lips than I ever wanted to see ever again. I had sort of thought we were kind of all in this together. I knew that there was a lot of politicization around a number of the healthcare measures for keeping people safe, but I at least thought that on the mask, even though it has been politicized, that in big blue New York City, we would at least still see maybe half the population still wearing a mask. And doctor, they're just not doing it. So you're talking about these potential surges that might come from other places. And yet all over America, 70% of us, according to the CDC, now live in a place where we don't have to engage in these sort of protections. But then I wake up this morning, and as I was continuing to prepare for this conversation, I'm seeing South Korea is breaking grim records of daily infections. Hong Kong retail chains are rationing staples to curb COVID panic buying. South Africa is risk at losing 100 vaccine doses. The USF, all over the world, we're literally seeing people going through various phases of the pandemic. But here in the US, we seem to have thrown out our masks with last year's Thanksgiving leftovers. What are you seeing internationally that should inform how we are approaching our consistent or inconsistent approach to safety here in the States?
Well, the Centers for Disease Control came up with this color coding system where green means we're pretty close to normal, and we no longer have to have mask restrictions, mask requirements. And I understand that everyone's exhausted and tired of the pandemic. I think the one mistake, I actually like the county-based color coding system because, for too long in this pandemic, we've only talked about state rates or across the country, and it's a big country and there's a lot of variability, so it's too blunt an instrument. So I think the county level maps are a good way to go, and I do think masks can come off for a lot of people with with the exception of those who are immunocompromised and or those who have concerns. And many of us, I'm still wearing a mask when I go indoors in a crowded area. So if it's when I come here to work, I close the door, I don't have a mask on, but if I go out in the hallway, I'm still wearing a mask. I think but whether or not, we're having, in those green areas as the CDC defines them, where there's very little transmission, whether or not you wear a mask right now, I think is less important than getting people ready that we're not out of this and that another wave could be coming. And that's the one problem I'm seeing is we're not getting that kind of anticipatory guidance to say, look, right now things are looking good, but get ready. We still have issues across the world and we're not vaccinating the world as we should. So there's still the danger out there that it's coming back. And many of us think it's coming back in the summer. Others are saying next winter, but it's likely to come back. And that's the key, is because we don't do that enough. This is the mistake we made with the boosters, for instance, which, we said 2 doses and then we're done. Whereas I said, hey, wait a minute, this is going to be a 3-dose vaccine, but that wasn't reinforced. And if we had done that and said, hey, get ready because we could see declining immunity, we're going to need another booster in 6 to 12 months, people would have understood that and gotten it. But that's the mistake we make in our communications.
I was watching you in an interview when you made that statement some time ago, and I remember thinking, "What? 3 vaccines or a booster?" And nobody else was saying that. And I thought, well, this Dr. Peter Hotez, who does he think he is? But then, I remembered who you are, so that helped me to calm down a little bit because, again, how I feel about scientific information is less important than what the scientific information is saying. I want to come back to you in just a moment, Dr. Hotez, and talk about your efforts to fix some of the issues that you've outlined. But Dr. Hudson, when you're hearing what Dr. Hotez is saying and you're thinking about what's happening globally, and we had you on not so long ago with Dr. June Francis, who you were really helping us to have that international understanding about what is happening. As you see, the new charts, and we've got the green, and I just noted this morning that New York City within a week went from very low to now we've inched up a bit. And it's like, damn it, we just got the numbers low. Spring can't sprung if we don't get this under control. Yeah. Dr. Hudson, what are you seeing as you think about what Dr. Hotez just said as it pertains to the Pan-African community and communities of African descent in particular? How should we be getting ahead of the curve? Because we already know once the CDC and other guidance regulatory agencies change the guidance, it's going to be a few steps behind, which means our communities will be like a couple of blocks behind. What should we be doing now so that we're not so busy putting our guards down, but we're still mindful of the fact that we have to be prepared for the next surge?
Yeah, I think that's, as Dr. Hotez says, that's the biggest, I think, error in how we've rolled out the public health communications, right? Because the CDC announces, it's okay to take your mask off, and everyone is like, cool, we're done, it's over, immediately. And we've never been consistent with communicating the nuances of, except there's immunocompromised people, except all of these communities of color are still lagging behind in vaccinations. We're all lagging behind in boosters, right? And, as Dr. Hotez pointed out, all of the places in the world that nobody cares about, where they're just like, who cares when they get vaccinated? Let them perish. Those are the places where the variants are emerging from, because we don't care enough about each other to understand how the virus moves, how it works. And while it may be, in a vacuum on its face, sound rationale for them to have, lifted the mandate for now, I think it's dangerous and irresponsible to do that without people having a really clear understanding about their own personal level of risk, which I don't think anyone does. And I think there's also still a lot of resistant communities, both Black and white, who are never going to get vaccinated. And so they're always going to be available hosts for the virus once the surge picks up again. And so, I really hope that, moving forward, one of the things we're trying to do is to help people to understand that this is a battle of the species, and to really bring that to the fore so that people understand the role that they play in hosting the virus if they refuse to take the responsible measures to reduce contamination or spread.